have a lot of patients that say they want to consider biologics, but they just don't like the idea of a needle or an injectable. And I understand that. That's really uncomfortable, especially when they're self-administered. When we do prescribe these medications, they often do have a training process that often the medication will provide, or oftentimes your doctor can help you through that initial injection as well. Most do come in a pen form, which can be very easy to administer. It's a clickable pen that gets the medication administered within seconds, and they only go superficially into the skin. That pinch on the surface is not as bad as you might think. The medication, they're often refrigerated before you administer them. Taking it out and letting it get to room temperature over 10 to 20 minutes can reduce that temperature differential between your skin and the medication. Even icing the skin before administering it can reduce that initial pain on injection. A lot of our patients find that these are better tolerated and taken at a much less frequent interval. Think about taking a medication on a daily basis and trying to stay consistent with it, versus an injectable that might be done once a week, every other week, every fourth week, every eighth week, depending on which one is chosen. But that is sort of a small thing to go through to get a huge benefit. We can go through this with you and talk through some of your concerns, whether it's being a little nervous about a needle or an injection, what this might mean. That's what we're best suited to do because we do this routinely. So knowing that you can talk to your doctor about every step of the way is really important.